Assalamu alaikum. I am Dr. Moyeedul Islam, Associate Professor of Pharmacology, Sakina Women's Medical College, Jashore. Today we will discuss about the adverse effect of insulin and the important adverse effect of insulin, that is hypoglycemia. So in this lecture we will discuss about the different types of hypoglycemia and what will be the management of hypoglycemia. We will discuss it in this session. Hope you will enjoy this session with your concentration, and please concentrate on this session, because this session is based on hypoglycemia, that is the spontaneous hypoglycemia and true hypoglycemia, and also the diabetes mellitus patient suffering the hypoglycemia that is related with the excess insulin administration, that is the insulin induced hypoglycemia. Now we will discuss about the adverse effect of insulin. The adverse effect of insulin are different type of adverse effect can occur by giving insulin. The one is hypoglycemia. There are different types of hypoglycemia occurs nowadays. One is called spontaneous hypoglycemia. Spontaneous hypoglycemia is a one type of hypoglycemia that occurs in non-diabetic patient, and the causes are different. There are different causes present in spontaneous hypoglycemia, and this spontaneous hypoglycemia is called spontaneous hypoglycemia when the random blood glucose level of any patient less than 3 millimole per liter, that is called the spontaneous hypoglycemia. Sometimes true hypoglycemia present over any type of patient, and that is the random blood glucose level is less or equal 2.2 millimole per liter, that is called the true hypoglycemia. In case of diabetes, the hypoglycemia, the patient suffering hypoglycemia when the random blood glucose level is less than 4 millimole per liter, or somebody calls less than 3.9 millimole per liter, then a diabetic patient can cause hypoglycemia. In a diabetic patient, the hypoglycemia can occur due to excess giving of insulin, or excess giving of insulin in a missed meal patient, or excess giving of insulin after a vigorous exercise, or a patient giving insulin that the patient missed any meal, that causing the hypoglycemia. Or sometimes there is a excess insulin can cause this diabetes mellitus patient in hypoglycemia, that is called the insulin induced hypoglycemia. If we discuss the spontaneous hypoglycemia, there are different type of cause that cause the spontaneous hypoglycemia. In case of spontaneous hypoglycemia, we should know about the Whipple's triad. What is Whipple's triad? Whipple's triad means there is presence of sign symptom of hypoglycemia, and this sign symptom of this patient, if we measure the blood sugar level of this patient, we will see there is hypoglycemia present over there, and if we treatment of this patient by giving carbohydrate, the symptomatic control can be occurred in this hypoglycemia. This is the Whipple's triad, and in this Whipple's triad, if the cause is in the pancreas and this pancreatic beta cell, if the cause is present over there in case of insulinoma, in case of hyperinsulinism in infancy, and sometimes in sulfonylureas poisoning, or sulfonylureas give a prolonged period of time, or more sulfonylureas are taken over there, this type of cause we can identify by measuring the random blood sugar level, and also by measuring the insulin, and also measuring the C-peptide. In this type of patient, there will be more blood insulin, and also there will be more C-peptide. Why there is more insulin or more C-peptide over there? We know that these sulfonylureas, they stimulate the pancreatic beta cell and release of insulin. When there is release of excess amount of insulin, there will be excess release of C-peptide, because insulin and C-peptide are released in equimolar amount. So this type of patient facing the problems of hypoglycemia, and this type of patient are facing the spontaneous hypoglycemia that can be caused by insulinoma, or that can be caused by hyperinsulinism in infancy. Sometimes the drug abusing, such as sulfonylureas abusing, and also the different types of drug abusing, sometimes producing this spontaneous hypoglycemia. Another type of spontaneous hypoglycemia that can be caused by giving of excess exogenous insulin. In this type of patient, the random blood sugar level is less than 3 millimole per liter, that shows the spontaneous hypoglycemia. And also if we measure the insulin and C peptide level in the blood, we see the increase the level of insulin, but the C peptide is not increased, or the level of C peptide is decreased in this type of patient. And the cause of this hypoglycemia is due to use of exogenous excess of insulin. There is another cause of spontaneous hypoglycemia that occurs in non-diabetic patient. Sometimes alcohol, excess use of alcohol, and sometimes the metabolic derangement causes this type of spontaneous hypoglycemia, in which there will be no increase of insulin or C peptide, and the level, if we measure in the blood, the level of the insulin and C peptide will be low in this type of patient. And this type of patient, the cause of this type of patient hypoglycemia may be alcohol intoxication. Some drugs can also cause this type of spontaneous hypoglycemia. One is quinine, another one is aspirin poisoning, and another one is pentamidine. Sometimes the metabolic derangement or metabolic disorder can also produce this spontaneous hypoglycemia. If the patient is addicted on alcohol, or there is alcohol intoxication, that produce the spontaneous hypoglycemia. Sometimes some drugs can cause spontaneous hypoglycemia, that is aspirin poisoning, or sometimes the salicylates, or sometimes the pentamidine, and also the quinine can also cause the hypoglycemia. These are the important causes of spontaneous hypoglycemia. Another important causes of spontaneous hypoglycemia are the metabolic derangement or metabolic disorder. These are the liver failure, renal failure, inborn error of metabolism of child, and also some endocrine disorder can also responsible for spontaneous hypoglycemia, that is primary adrenocortical insufficiency, and there is a non-islet beta cell tumor, that is the sarcoma, can cause the spontaneous hypoglycemia. And this type of patient, if we measure the blood insulin and C peptide, this patient, this alcohol intoxication patient and metabolic derangement disorder in this patient, they are facing the decreased level of insulin and decreased level of C peptide in their blood. So that's why these are the important investigation that we can do this spontaneous hypoglycemic patient, and this hypoglycemia mainly occurs in non-diabetic patient. In diabetic patient, hypoglycemia mainly occurs due to that is the insulin induced hypoglycemia. And this insulin induced hypoglycemia, the features of hypoglycemia, two types of features are showing in this type of hypoglycemia. In this diabetic patient hypoglycemia, the random blood sugar level is less than 3.9 millimole per liter, and these patients are suffering from two types of symptom. One is due to neuroglycopenia and another due to autonomic symptom. What are the consequences of this hypoglycemia? One of the consequences of hypoglycemia, when there will be hypoglycemia, there will be no release of insulin from the pancreatic beta cell, and there will be autonomically presynaptic nerve terminal, there is excess release of norepinephrine that acts on the systemic circulation and acts on the different types of their receptor and produce some symptoms. And there is also another thing, the glycogen that becomes breakdown into the liver, and the glucose comes into the blood for giving the glucose into the brain to prevent the neuroglycopenia. So these are the important consequences of hypoglycemia. So these important consequences of hypoglycemia shows two types of symptoms. One is autonomic symptom and another one is neuroglycopenic symptom. When there is neuroglycopenic symptom, the patient will be irritable, the patient inability to concentrate, the patient also shows some anger, and there will be blurring of vision, and sometimes patient can be fall to anywhere. And the autonomic symptom shows some sympathetic symptom, that is tremor, tachycardia, palpitation and sweating. These are the sympathetic symptom of autonomic symptoms in hypoglycemia. And another symptom is parasympathetic symptom. in which the patient is eagerly take to eat food and patient is inability to concentrate and patient hunger contraction occurs in this type of hypoglycemia. How can we manage this hypoglycemia? We can easily manage the hypoglycemia. At first, reassurance this patient, and there will be no problem if there is available of carbohydrate in the place of hypoglycemia. If the patient is conscious and able to take food, at first give the glucose drink. The glucose drinks are present over the Coca-Cola. If we bring the patient the Coca-Cola, if we drink the patient Sprite, or if we drink the patient the glucose containing dextrose, if there is no available Coca-Cola drink or glucose drink over there, we give the patient a sugar containing beverage or some teaspoonful of sugar can be mixed with the water and this given to the patient. If this glucose drink or the sugar is not available, give the patient 1 milligram of glucagon, because glucagon causes the release of glucose by breaking down the glycogen from the liver, and when the breakdown of glycogen makes glucose, more and more glucose comes to the blood that control the hypoglycemia and the patient relief of hypoglycemia. If this glucagon not available in this situation, give the patient some sugar into his buccal mucosa, this patient will survive in this time. There is another thing, if the patient is unconscious and not able to drink, we should give 20 to 50 ml of 50% glucose, and if this is not possible, we should give the 1 milligram of glucagon. If this is not possible, give the patient the glucose into his buccal mucosa and mix his buccal mucosa with this glucose, and this will helpful to prevent this hypoglycemia. In this situation, we first control the immediate hypoglycemia. To prevent the chronic recurrent hypoglycemia, we should give the refined carbohydrate food to this patient and regular check up the random blood sugar level and adjust the insulin later. If we think that this is not a case of diabetes mellitus, that is this patient is not diabetic or this patient is not due to insulin induced hypoglycemia, we should find out the cause by giving different types of investigation. We will rely on CT scan or MRI of the abdomen, and we will go for some investigation that is related with the blood insulin and C-peptide, and that is why we can easily find out the cause of hypoglycemia. If the cause is insulinoma, there will be a tumor present, CT scan or MRI, this tumor may be small or tumor may be large. If the tumor is small, the tumor size will be less than 5 millimeter, and the tumor is large, that is more than 5 millimeter. And in this insulinoma, we also see the insulin level and C-peptide of this patient. In this insulinoma, we see that there is excess release of insulin from the pancreatic beta cell and also excess release of C-peptide. So, diagnosis, after confirming the diagnosis, we can give the diazoxide and somatostatin analog to this patient. So, thank you all. This session is really important to understand about the hypoglycemia and the types of hypoglycemia, and also the important thing that we discuss about the insulin induced hypoglycemia and its treatment. So, next class we will discuss the another adverse effect of insulin that is so much important in the professional examination. Hope you will enjoy this class. Thank you all.